What is going on, everybody? Welcome to the latest episode of The Legislative Director, talking about legislative things. Here she is. She is an emerging Instagram influencer. Ask her about her shoes. Legislative Director Amber Marr. That joke will make more sense here later in the show. With her, as always, not the Legislative Director, Jason Thompson. Amber, how are you?
I should have had producer Anna put the link to the shoes in the show.
Yeah, we're gonna get her there. We're gonna have like an affiliate. Yeah, hit on my link. You know, discount code legislative things. Let's make it happen.
Discount code legislative things.
Let's make it happen.
No, I'm not an influencer.
Not yet. But we'll get you there nonetheless.
Okay.
So I don't remember. It's been like, I don't know, 2 weeks. Has it been 2 weeks?
It feels a lot longer.
It does feel a lot longer. Because I know we last time we chatted, it was right before the race. The race is come and gone, and then a whole nother week. It's just been.
Speaking of the race, maybe I will be an influencer.
Here we go.
Race ring. If you guys want one, I can tell you where to get this too. Okay.
We can't zoom in, but it is this like checkered, thing. There we go. There we go. See, you can see it. Yeah, there we go.
Okay.
So for those of you that are listening, you have no clue what's going on right now. But it is a black and white checkered flag looking ring.
Yes.
It's fabulous. And a nice little reminder of the race.
Yeah.
But yeah, so it's been some time. I hope everybody's summer is getting underway, even though it's not like, officially summer, I guess. But it's
already
after
June.
It is already June. I got some big events coming up in June.
Somebody actually celebrated a birthday at the end of last month.
This is true. That was me. It was my birthday at the end of May.
Yep.
And then we have somebody's birthday who's coming up at the end of June. So
very exciting.
We'll try to time up an episode for that as well. We'll bust out the hats again.
Oh no. Okay. Definitely not the noisemakers.
And maybe instead of the episode number, we'll put your age in the balloons. We did.
Okay.
So if all of a sudden...
No! No, you're not putting my age in the balloons.
We are. Maybe we will, but we'll put it in the show notes. Anywho, Amber, like we've ever put anything in show notes. I don't even know what we're talking about.
Where do you put the show notes?
I don't know.
Okay.
We'll find out, though, maybe. Anna can help us out.
But welcome back.
Welcome back. It's good to see all of you and be with all of you, Amber, yourself included in that. Let's get into some legislation.
We have on similar AARP shirts.
We
but
do.
Not the same this time.
Yes. But usually we try to coordinate somewhat. But
mine's like when you send a message on your iPhone where you want it to be like
right in your face. Yeah, it's pretty big. And so you got the short sleeve with the big letters. I got the long sleeves with the little letters. It's weird.
It's great.
Okay.
All right.
So let's talk about. So we're still talking legislation. Since I know the conversation continues. We got a longer list today of things. Most of these having to do. Amber's already bored in the healthcare space.
I'm just sleepy.
It's the late afternoon, when we're recording this.
Yeah.
So it's approaching nap time.
Just you make it sound like that's all I do.
You don't nap.
I'm tired and I nap. I think that's what we talk about every show.
And the weather.
And the weather. And I'm about to tell you all something that I just looked out the window and saw. There's someone filming on the parking garage over there. Yeah.
Oh, yeah, some TikTok action, I think, happening.
I'm really not sure what's happening.
I mean, this isn't awkward for him because he can't see us, but it's awkward for us watching. That's a big hat he's wearing.
It's a very large cowboy hat.
Yeah.
And he has a tie on.
Yeah.
And he has his video camera set up.
Yeah.
And he's doing some sort of I don't know.
I don't know the TikTok trends that are going on.
Well, he looked like he was going to start to dance, but he didn't.
One can hope. Anyway, okay.
So whether you get all of these updates, there is a random gentleman in the parking garage
across the way.
Yeah. Filming some TikTok videos. Okay.
Awesome. This was great. Wow.
I'm sure you've all missed us.
If you're still with us, let's talk some legislation.
I hope you are.
First up is SEA2.
Yes.
Medicaid matters. Look, Medicaid was quite the topic this session from the growing portion or percentage of the budget that it consumed. This was an attempt to try to kind of maybe get that under control. Am I saying that correctly?
Yeah, this is dealing specifically with the Healthy Indiana Plan, which was how we expanded Medicaid.
Yep.
And it went through a lot of changes over the course of, the 4 months we were in session. But really what happened at the very end and what it looks like now is that the bill mandates that FSSA can only restrict enrollment if it surpasses the amount of money that we have for funding of Medicaid.
Okay.
So the amount of money that they've put in the budget, if for some odd reason enrollment surpasses the dollar amount that we have available, they will have to restrict enrollment.
Okay.
But not until we've reached our limit.
Mm-hmm.
The other piece is they put in a work requirement where individuals have to have 20 hours of either volunteer or work to maintain their enrollment status.
And that's something that's actually happening and being discussed on the national level as well.
Yes.
So the work requirement thing, and this is our second go around with the work
requirement.
That's hard to say.
It is hard to say.
Work requirements.
Yes. The first go round was during the Daniels administration. And I believe it was actually after we got everything ready to go live for the work requirement, it was actually removed by the federal government. Or not removed, but struck down.
Okay. And so, but there is an important
piece to Senate Enrolled Act 2 because we actually did not take a necessary, like an outward position on this other than we really wanted, if they were going to require work requirements, I shouldn't use that same word in the same sentence, but if they were going to go forth with work requirements, we wanted it to either one, have an exemption for caregivers or use caregiving hours to count as your hours.
Yeah, because it's like 20 hours?
It's 20 hours
20
a week.
Hours.
Or if you're not doing 20 hours a week, you could risk losing your benefits.
Yeah.
But we worked really hard getting this either, like, again, an exemption or a qualifying factor where caregiving can count as those 20 hours. In the end, we were very grateful. Representative Clear was able to get an amendment in the House Ways and Means Committee that exempted caregivers.
Okay.
Yeah.
That's huge.
And actually, let me just make sure I say this correctly. The exemption would be for a parent, spouse, or caretaker who is personally providing care for an individual with a serious medical condition or a disability.
That's a big win.
So, yes.
And
before that, sorry, I keep interrupting you.
Yeah, no, you're fine.
Before that, it did not have, it was just for a parent caring for a child, a disabled child.
Okay.
And now this encompasses all of that. And it adds spouse and caregiver for anyone that has a disability or a serious medical condition at any age.
Look, that's huge.
Yes.
Good work on helping to make that happen.
The work requirement still has to be approved by the federal government, though.
Yes. So we'll stay tuned for that.
Yes.
But at least there is that positive exemption that is in there.
We were really, really hoping that we could get that in there. So again, another thank you to Representative Clear for helping us with that. There was a small concern that when it went to the House floor during second reading amendments, there was an amendment to remove that amendment.
Mm-hmm. A lot of amendments.
I think just because, with any exemption, they just wanted to keep it very narrow, but that amendment was not called down. So Representative Clear's amendment remained in the bill, and then it moved on to third reading. It was voted off of the floor. And the final House vote was 66-28. And then it went back to the Senate and they concurred with the changes, and it was signed by the governor on May 1st.
Okay.
So we were just very grateful that exemption was placed in this bill for caregivers.
Okay.
So I think that's all. We do have to continue to watch this, figure out what the federal government's going to do.
Yeah, a lot of moving parts.
Yeah, there's still more to come here, I think.
All right.
Yeah.
Well, moving on, we're going to talk next. We're moving to HEA 1226, which is Medicare Supplement Insurance.
Yep. This is the birthday rule.
Birthday rule. Look,
Yes.
I just had a birthday. You got one that's coming up. We don't qualify for this stuff yet. But what is the birthday rule?
Yes. So now Indiana joins 9 other states that have adopted this birthday rule. Basically, it gives Hoosiers a 60. I'm sorry, let me back up. Anyone who is on traditional Medicare has to pick a supplement plan or a Medigap plan. And normally you do that right out of the gate when you sign up for Medicare if you're staying on traditional Medicare. So you can change your supplement plan. However, normally it's not ideal because you will then be subject to medical underwriting. So pre-existing conditions would come into effect at that point. And usually in order for you to change your supplemental plan, it is increased in premiums or it's not as much coverage, I think.
Yep.
But regardless, while you are able to, usually it's very impossible to do. Very impossible. It's impossible to do so. This particular bill will allow Hoosiers a 60-day window starting on their birthday every year to switch to another provider. They have to stay in the same plan, but they can switch providers without being subject to medical underwriting, which means that they could potentially get a premium that is lower than what they're paying in other states, the 9 other states, which include California, Idaho, Illinois, Maryland, Oregon, Nevada, Louisiana, Oklahoma, and Kentucky. Individuals have saved hundreds, if not up to $1,200 in premiums with this particular piece of legislation.
Yeah, it's real money that people could be saving, and it gives folks that kind of flexibility each year, so they're not just locked in to that plan.
Yep,
that's awesome.
What did I forget? I'm going to make sure that I said everything. I think that's pretty much it. Yeah. So we just wanted individuals to be able to look at other providers to see if they had cheaper premiums, and they are able to do that again from 60 days from the day of their birthday every year if they are in traditional Medicare and have a supplement plan.
Okay.
And this was signed by the governor April 10th. And it passed out of the Senate 45-2 and out of the House 94-0.
Good numbers.
Yeah.
Awesome. Next up.
Sorry, I got distracted.
It's okay.
This is the problem with having a smartwatch.
Yes.
And I even put my phones over here.
I did the same. And they're actually on silent, which is usually not the case.
Well, no one's called you, I don't think. So if you have JT's number, call him real quick because maybe it's not on silent.
But you're not going to hear it because by the time you're watching this, this will have been in the past.
True. Darn it. Okay. Well, test it on on Thursdays usually.
Usually when we're recording
but it's a
at any
Wednesday.
time. Yeah. Test it.
You know what? Just randomly call him. Because I can guarantee you his phone's on silent.
And I'll put that number on the screen.
And we're yeah.
Just kidding.
And usually we're in a meeting, so whether it's this and we're recording or we're in a meeting,
all right,
just make sure it'll ring real loud. I know it.
Let's HEA 1297 is our next bill.
Well, what I was going to say is the reason why I was distracted is because my protein bars are going to be delivered.
Ooh, that's pretty huge. Look, these protein bars, let me tell you, I haven't tried them, but look, no free ads here.
I think I am going to become an influencer.
Yeah, I think you are.
Span a million items. We've got food. We've got clothing. What was the other one? I forget.
I don't know.
The ring. Oh, jewelry?
Yes. There we go. Look, on her way. She's on her way. We're going to get her there. Through your help, we can make it happen.
Because then I would make it a full-time job. Peace out.
All right.
Okay, back to 1297.
1297, the Yellow Dot program.
Yes, Motor Vehicle Medical Information Program. HEA 1297 creates the Yellow Dot program, which basically it is a voluntary program where you can go and get a packet either from your BMD or your local area agency on aging, where you pick up the packet and inside it will have some forms you can fill out that is health related. That will eventually, once you fill them out, they will go in your glove box and they will give you a yellow dot. And that yellow dot will go on the back windshield of the driver's side. so that if anything happens to you while you are in your vehicle, the first responders will know that if they see that yellow dot, they can go directly to your glove compartment and figure out what you are allergic to, what medications you're on, your emergency contact, all of these things, so that they can get you help faster.
Yeah, a quicker, more informed decision.
Yes.
Can help responses, I should say.
And again, it's at no cost. It's voluntary. There are 22 other states that have it. So
and people are going to be able to get these envelopes and yellow dots. Where are they going to be getting them?
Oh yeah, sorry, just a repeat. Because I think I already said it, but
sorry.
No, that's okay. Just to remind folks, it's you can pick it up at the BMV or your local area agencies.
Okay.
Local area agency on aging.
Wasn't sure if we had to go to the AAA thing. That's what I didn't hear. Awesome.
Yes.
Well,
and
cool.
we are very grateful to the AAAs for being a part of this, and we're going to try to help and be a part of some of the
education,
around
outreach
the
around that. Yeah,
yep.
Cool. So that flew through the House and the Senate fairly quickly.
There was not even a no vote.
Ah, look at that. How often does that
happen?
happen?
By the governor on April 10th.
Awesome.
Okay.
All right, next up, HEA 1391.
This is Services for the Aged and Disabled, and this initiates the Medicaid Diversion Pilot Program to evaluate how home modifications and other chronic care services offered by specific AAAs can help lower Medicaid costs. We were just talking about how our Medicaid budget has just blown up. It's almost as much as our K through 12 education budget. And so we are looking at ways with the Choice program to really create a Medicaid diversion program. So instead of just having Choice sort of be a waiting time frame where you're on the Choice program because you're waiting to get on a waiver through Medicaid. We really want the Choice dollars to help keep you in your home, really be preventative. And sometimes those dollars are. It's just that we want to really test to see if there are other services added, if it can be a true Medicaid diversion program.
Okay.
So what else is in this bill? Let's see. Okay. So there's also another piece to this, that the FSSA and the AAAs are going to conduct a comprehensive review of the AAA service areas to really identify potential updates, if there can be changes made, improvements, because we know that there are some things that could work better. So we wanted to enhance the delivery and efficiency for individuals that are using these services. And hopefully this study will really show if things could be improved, if things could be consolidated, or if there are just other ways we could be doing things better. So that is also in this bill. And there are a few other things, but I think those are the highlights.
Those are the highlights.
Yeah.
Okay.
Is that good?
That sounds great.
So we appreciate being able to come alongside Representative Clear and the Indiana area. I'm sorry, it's the I4A, but it's the Indiana Association of Area Agencies on Aging. So we were really working side by side with them throughout the process on making sure we got this passed. But we're looking forward to continuing this conversation and really helping along the way.
Yep. Awesome.
It was signed by the governor on May 1st, and it passed out 80-0 in the House and 47-2 in the Senate. Also
good numbers. Last bill that we're going to talk about, HEA 1587. Look, this is a large insurance bill.
Yes.
And there's really only one portion of it that we were concerned about.
It was a very tiny portion.
Yeah.
However, it was in our opinion,
we think it's a big deal.
It was a very important piece of the legislation, even though it made up only a couple sentences. So in this bill, we supported a new requirement that health plans will reimburse for emergency medical services that are performed or provided as part of a mobile integrated health program, which we have talked about multiple times.
Yep.
You can go to
AARP.org/IN, and you can see those videos. Healthcare the Hoosier Way. It's also on our YouTube page. You can see a couple of videos there from Crawfordsville and Monticello.
Yes. So if you're not familiar with mobile integrated health, it is an amazing program where it's a patient-centered model of care where they come to the patient's home or even in a mobile environment, and they give a range of services, which includes diabetic monitoring, disease management, vaccines, substance abuse and mental illness mitigation, all of this falls. They help.
Yeah.
They don't help with falls. They help
prevent them.
Prevent falls.
Yes.
And it just really is a way for individuals to stay in their homes and communities as long as they possibly can.
Love it.
And they've been really successful in curbing readmission costs.
Mm-hmm.
And the sort of what's the word I'm looking for? Inappropriate use of emergency rooms.
There we go.
Because a lot of times older Hoosiers get nervous, and so like when they're not feeling super great, they'll just immediately go to the ER, and that kind of happens over and over and over.
Yeah.
Well, mobile integrated health programs will really prevent that and kind of help alleviate some of that concern if they really don't need to go to the emergency room.
Yes, it's good stuff. Excellent.
Boom.
Well, boom. Look at that. Excellent work, Amber, on all that.
Oh.
Oh.
It's totally off topic.
Okay, what's going on?
The Pacers.
Oh, yeah, there we go.
We didn't bring that up.
In the NBA Finals for the first time in 25 years?
I thought it was 25. Could have been 20.
25. I think it's 25.
I think it's 25 too.
I'm not entirely, but yeah, big deal around these parts.
Huge deal.
We have a little friendly wager with our counterparts in Oklahoma.
Mm-hmm.
So we'll see how that turns out. So
hopefully we'll be getting something from them.
I forget what their local delicacy that will be shipped our way.
It's like a chocolate.
Yeah, and I think we're sending some sort of popcorn. I believe.
Yeah.
Cool. Well, good shout out for that.
Sorry, just because I was like, boom, and then I was like,
boom, baby.
That's what made me
the Pacers. Awesome. Yeah. Okay. We'll be watching closely. Tomorrow. We're filming this on Tuesday. Game 1 is on Wednesday.
I always think we're live.
Is it? No, wait. No, we're filming this on Wednesday.
It's Wednesday. So tomorrow's Thursday.
So tomorrow's game Thursday 1 is on Thursday.
8:30, right?
Yeah, I think so.
All right.
And then when you see this, yeah, we'll see who's up in the series.
Mm-hmm. All
right. Cool.
All right. Wait, we got
a couple things left
we
were talking about. So the first thing is we were participated in a pretty cool event with friend of the program, friend of the show, and just friend to all, Dr. Crowder. With the IU School of Nursing. Why don't you talk about it?
I thought you were going to say it.
Well, it's because I didn't write it down, but you have it written on yours.
Oh, okay. So the IU School of Nursing, specifically Dr. Crowder and many others that participated in putting this together, but Dr. Crowder really was at the
driving force, if you will.
Yes, that's perfect. That was a great way to say it. It was called the Policy Academy, Navigating the New Realities of Health Policy. It was a 2-day conference. And on the first day, there were, I think, 2 panels.
2 panels, yep.
And we were panel number 2, and it was called Transforming Your Messaging. I didn't read that right. Transforming Your Messaging Advocacy Impact. So basically, it was about how you message things, how do you make an impact, how do we create our messaging? And there were, I had this somewhere. There were 4 of us on 5
of us.
5. See, this is why I tried to take a picture of it so I could read it. There were 5 of us, and we wanted to give a shout out specifically to 2 of our volunteer legislative team members, because Vicki and Jeff were on the panel with me. And then also I just wanted to give a shout out to Dr. Krista Longton and Dr. Janice Phillips, because they were fantastic. They were 2 individuals that sat to the right of me, and then Vicki and Jeff sat to the left of me. And we just sort of all got an opportunity to talk about our background, why we do what we do, why messaging is important, why consistent messaging is important, why it's also important of who delivers the message, all of the things. And so we were very grateful to Dr. Crowder that provided us with this opportunity, and all of the attendees that were there listening to us talk about this. But it was a great 2 days. And I think she's even got we
got a picture up there on screen. So those of you that are watching the video, that you could see Amber and Jeff and Vicki there at the end. And then I was fortunate enough to moderate the panel.
I left.
No, it's okay. It was
he was the moderator of the entire panel.
I had the easiest of the people on stage there.
I
easiest
did say
job.
I just didn't. Sorry, JT.
There you go. Look, we had a closer up shot of Jeff and Vicki. I think Jeff making a joke because Amber's laughing at it. We'll see.
Who knows what I was laughing
at.
And
then there's a little and Anna was there as well, and Kate.
And Anna, while she she was the one taking these pictures. I mean, obviously this one she's in, but as a reminder, Anna was a former fellow with us from the IU School of Nursing, because we do have a wonderful partnership with them that we are on our 3rd year of that fellowship. And so the other individual in here that you see is Kate, who was our first fellow, but then also came on as a volunteer and stayed with us through our legislative team, but then has also sort of gone into other avenues of volunteering.
She's been a great fellow, great volunteer, and she was there as well, helping to kind of coordinate some things. And then there was a reception in the evening, kind of recognizing the different. There's a lot of fellows there outside of even obviously outside of our program that work with Representative Clear. During session, and there's a picture with us with Representative Clear. And
so, and Shannon couldn't be there at the reception, but we had Kate and Anna, and then Representative Clear with us to kind of just celebrate this amazing collaboration. Yeah,
it's fun, good people to work with.
Yeah,
we were excited to be there and be a part of it. And now, also happening, and this is where we can get to the. I'll let Amber explain who this is.
Okay.
And what's happening with this.
I don't know if we've said this on our show yet, but within AARP, we have something called the Campaign for Action and the Center to Champion Nursing in America. And it's been a partnership with the Robert Wood Johnson Foundation and the AARP Foundation. We are and have recently found out that is going to be sunsetting.
Yes.
So I have been at AARP for 12 years, and I have worked with Wynn Quinn, who has also been with AARP for 17 plus years, I think. So for as long as I've been here, I've worked with Wynn. And when we found this out, and then we've been celebrating all of the successes that have come out of this group, and we reflect on all of the things that we've done. She was actually here in Indianapolis this week doing a completely different conference around grant writing. And I was able to pop over after attending the Policy Academy for 2 days to catch her at her conference to say hello. And so this was us. I was able to see her and say hello and catch up before she so eloquently, as she stated, parts ways. I think she is done early July, but we will miss her greatly, although hopefully everything that we're going to be doing will still cross paths.
Yeah, we're going to, I think Wynn watches the show, I think she says.
Does she?
I don't know if she does. I'm making that up. If she does, get ready for an invite. We're gonna we hope to have her on soon to chat with her. And so just a lot of great work that came out of that the center the Campaign for Action.
Yes.
Sorry.
So basically that's why, because it's the Future of Nursing Campaign for Action and the Center to Champion Nursing in America, both initiatives, which I said were the AARP Foundation, AARP, and the Robert Wood Johnson Foundation.
So a lot of great work that has been done because of that group.
Yes.
And
all about nursing, elevating nursing, access to care.
All stuff we love.
Yes. Trying to make sure that patients just understand why nursing is so important, and building the workforce. I mean, you name it, we could go on and on. So
while it is sunsetting, and that's a bummer, we also do need to just kind of say congratulations for all the work and accomplishments that they were able to do, and wish Wynn well.
Wish her so well
on her next endeavors. That's a great picture.
And thank her for all of her service with AARP and for all of her work.
And for those of you that are watching when I mentioned shoes from earlier, there you go. That's like, subscribe, tell your friends, but then that's how we get around there. Amber shoes, there they are. So you can find them on Amazon.
I don't have a discount code.
No discount code.
There's not a discount code, but I love the producer and I've put those.
A lot of people asking about them.
Yes. Also wanted to say, because I wanted to make sure that we continued to, because this, I don't know what the fast facts are going to be like today. But the Campaign for Action has sent out an email thanking everybody, but also making sure that we continue to keep saying and driving forward and implementing the recommendations from the National Academy of Medicine's Future of Nursing 2020 to 2030, charting a path to health equity, because I think it's really important. So if you haven't seen that report, take a look at it, keep it in your back pocket, and understand that we're going to continue to move that forward.
Awesome.
Okay.
Cool.
Sorry, that was thanks for coming to my TED Talk about nursing.
This show is just one big TED Talk. So we will be, look, we're like we're big fans of nurses around these parts. And there's going to be kind of you'll see and hear from more folks along those lines, hopefully in the weeks and months to come. Now we have come to the point in the show. It's everybody's favorite part of the show. Fast Facts with Anna. Anna, hi. Anna, as our resident and favorite nurse, how are you?
Hello. I'm good.
We're excited to have you. And thank you for putting up all the pictures.
You're welcome.
Yes.
Anna, and then since you are our resident, also our resident race super fan next to Amber, did you have a good time at the race?
Oh, yeah.
And show off your nails. Are those nails still there? Are those still happening?
Yes.
Look at that.
Oh, I'm so glad.
And my ring, too. My checkered flag ring.
With our powers combined. So
this is so amazing.
This is good stuff. Let's
you just get everything here.
Yeah, look, see what happens. This is what happens when we take these like a week off in between shows. We got so much to catch up on.
I forgot we hadn't talked about the race.
I know.
No, because it seems like it's been longer than it's been.
Seems like it's been years.
Yes, always.
But it is.
But it's good to see you, Anna. What are we talking about today? First of all, here we go. Big board. Amber has taken the lead
by a half.
She has.
Let's not get crazy.
Hey, a lead is a lead.
A lead is a lead. A win is a win. Let's not talk about by how much it was. Okay.
Okay. Let's just see
if she can maintain.
Keep that lead.
I'm excited.
Okay.
What do we got going on today?
So, since you were talking about nursing quite a bit today, we're going to talk about Indiana nurses.
I love this. I'm going to get it all.
So there's actually, we'll go through them quickly, but there's 3 questions.
Okay.
The second 2, no. Oh. So the second 2, the data came from the Bowen Center for the Health Workforce Research and Policy.
Okay.
But the first one has to do with the fellows program that is run by Dr. Crowder.
Oh, no.
So we'll see if you guys were reading the posters that were up at the event that we attended.
Okay.
So the first question, how many students and alumni have participated in the Eagles Health Policy and Advocacy Mentoring Program and Legislative Fellowship? So this is including our AARP fellows and the fellows with Representative Clear. And so if you're within 2, you will get a point on this one.
Okay.
I think it was mentioned a couple times during some of the presentations. It was on the poster, and it was also on the School of Nursing's social media post. So.
I didn't see the social media post. But I think hold on. I think I got it.
Okay, you go first.
You want me to go
same
first?
time, yeah, or we can do the same time.
Oh wait, are we ready, Anna?
Yeah, you can go.
Okay, I said 27.
I said 29.
Wow. Okay. The correct answer was 71.
Where did we get that from?
Anna, you're talking about the board that had all the Eagles on it, right?
Yes.
There were 71 people's names listed on that.
Yes. There were like 5 columns of names.
Yeah, but they were a big font size.
And they were only like 8 in a column, right?
Yeah.
That's what I tried to count in my head, the columns.
Nice.
71. I'm going to say, I don't know. I'm just kidding.
You can take that up with Dr. Crowder.
No, Anna
Not,
knows.
yeah, you know what? Like, at least I feel better that you and I were close.
I
Was
literally
it you
thought it was
guys were on the same
27.
page?
I
I
thought in my
thought
head, I was
29.
like,
I had 29. I was like,
27.
it was 29. I
Like, I
remember
was-
29 somewhere.
I wasn't even questioning it.
You know what? We got it wrong.
71. Well, you know what? How amazing is that?
Yeah, that's awesome.
Okay. Well, we shouldn't have missed that, but
That's okay.
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 Let's get some more wrong.
Anna, that's. I did read the poster though. I just clearly did
This
not
is true.
put it in my brain. All right, 71.
That's okay.
Okay.
But clearly a very successful program
Yes.
with 71 fellows.
That's
So
amazing.
Okay.
the next question, what % of the total Indiana nursing workforce specializes in geriatrics or gerontology? Now, I do want to clarify that this data set had about 50,000 nurses in it, and it comes from data that is collected when RNs go to renew their license every 2 years. So they'll ask you some questions when you're renewing your license.
Yes.
Ooh,
So that the nurses that fill that out is
A
where
little
this data
peek
comes
into
from.
the data.
I mean, the better question that I would have gotten is that how do they get this information? I could have said when they renew their license, but you didn't ask that question, did you?
I'm glad you know that though.
Yes, I know.
Maybe that's the next question.
I don't know this question though. The data set is comprised of almost 50,000 nurses. So what?
So of those 50,000, and this is probably pretty representative of the state as a whole, how many in percent nurses do you think specialized in geriatrics? Within 2%. What you got?
I'm not ready yet. Oh, I thought you were done.
I am,
Oh, I'm not ready.
but
Don't
I'm
do
not
it.
flipping it around yet.
Oh, okay.
We'll see if you guys are on the same page with this one too.
For those listening, we're just thinking.
Oh yeah, sorry. Do. Sorry, I can't use that.
Yeah, we don't have that license.
Cut it out. Pretend that didn't happen.
We're gonna get copyright strikes.
Yep.
I need just like 2 more seconds because I
Okay.
feel like I might be. I'm gonna write another answer in the bottom so I can see how close I was with the one that I had, the one that I'm gonna give you, and the one that I thought it was.
I can go first,
All
and
right,
then
go
maybe you
ahead.
can give you the opportunity. I said 12%.
Oh no!
It's probably too high.
Look at.
You wrote down 12 in
No,
the
no.
corner.
My guess was 5%.
Yeah, but she wrote down
But
12.
I wrote literally in the smallest number. I wrote 12.
Look, if you're within 2 on the 12, I'll give it to you.
No, that
Okay.
doesn't. You can't have 2 answers.
Okay.
I mean, I'll take it.
All right, are you ready?
Yep.
Yeah.
So the percent is 4.3.
Way to go with what you're. Oh, look at that. She gets a point.
I knew it wasn't a lot. I'm cheering
So-
because that is
I thought
not
12% was too low. Was low.
good. I knew it was really low.
I know
because
I knew it was bad.
We need a lot of nurses in gerontology, but
I
they're
didn't
not.
know it was that bad. Almost on the nose. Look at you.
Yeah, that was
Okay.
good.
I do pay attention in some of my nursing meetings.
Okay. Well,
Now,
I'm glad you didn't put that one down.
Me too.
now this last question is actually a little bit of a nod to myself. So
Oh,
we'll
okay.
see if you've been listening to things I have told you.
Oh no, Anna!
I'm totally gonna get this wrong.
You better get it right. I mean, I should
So-
also get it right, but okay.
How many nurses in the Indiana workforce have
Oh,
doctoral degrees?
you've told us this before?
Like the raw number?
Yes,
Plus or
Okay.
minus
within
30.
10.
How many nurses in the Indiana workforce have doctoral degrees? So we have to pick a number out of that 49,000.
Yes. Yes.
I don't know how I feel about this.
Uh,
I might need a calculator here.
Why? You're just gonna pick?
And
Well-
I guess I should clarify when I say doctoral degree, I mean PhD.
Out of
Because
49,000.
I've also told you guys the difference between the different doctoral degrees in nursing.
Yes, you have, but I couldn't tell you.
All right, I'm gonna change my answer.
You're gonna change it?
Yep.
49.
I'm probably gonna way undercount this.
And it's only plus or minus 10.
Yeah,
I feel like that's fair.
that doesn't feel great. Doesn't feel great.
Well, think about what that probably means for this number. I'm only giving you plus or minus 10.
Which means it's really low.
It is. I'm going with my number. I'm keeping it. I'm not going back.
All right. Amber, do you have a number?
I'm going to go with, Anna. I should know. I don't know. I'm trying to think of when you told me this. Okay. I'm going to go with, I'll just go with what I thought.
Okay.
Hold on. Let me write it again. It's way too high.
Mine's probably way too high too.
Because, or maybe it's not high enough. I don't know. Are you ready?
Yep.
Oh my gosh.
What?
That is not, wow, I'm way wrong.
Well, I don't know. I said 757.
7. Okay. Amber?
No. I don't want to turn mine around.
Go ahead.
Out of 49,000 nurses?
Look, I thought it was way
I said
low.
9,200.
Okay. These are very interesting numbers. Are you ready to see the answer?
Yep.
No.
88. And this was as of 2023. So this data was last collected for 2023.
That's nutty.
Isn't that wild?
That just makes me so proud of you.
Thank you.
You are one of 88. What?
Well, I wasn't in that. It's probably gone up a little bit since then.
Okay, so you're one of like 92.
The national data for the U.S., less than 1% of nurses have PhDs.
Wow.
You know what? That's also why I feel like a lot of higher education struggles to get teachers, right?
Mm-hmm.
Like professors, because you have to have a PhD to be able to teach. Am I right?
You don't have to have a PhD.
Oh, you don't have to have a PhD. Okay.
To teach at certain graduate levels and undergrad levels, like you can have a master's.
Okay.
A lot more nurses now have a doctorate of nursing practice.
Okay.
That's a lot more common, whereas the PhD is a little less common. The issue then becomes trying to get PhDs to teach other PhD students. So there comes an issue with finding that research faculty that has the experience that are able to mentor and teach those students.
That I have heard come out of your mouth before.
That one stuck.
That's insane. 1%.
Yeah, it's a very low number.
PhDs.
Wow.
I'm blown away.
Well, Anna, that was enlightening.
It really was.
This
was great.
Yeah, and you now firmly in the lead.
Yes, by 1.5.
It's losing ground here. Let's see.
Maybe we'll go back to utility questions.
Yeah,
No.
I don't know about that.
No.
We may be talking about.
I was just going to say we might be talking about it though.
We got for our Central Indiana friends, AES.
Yeah. You forgot to say that.
Just put in another request for a rate increase, even though their last one was literally just approved last year.
And I am an AES customer.
So get ready, folks, because
Anna, are you an AES customer?
No.
No. Okay. Didn't think so.
Nor am I. But
I didn't need to ask you. I know you weren't. Because you talked about it when we were. Who do you have?
Duke.
Oh no, who was from where you grew up?
NIPSCO.
Oh, that's okay. Never mind.
Yeah.
All right.
So there you go.
So we will be talking about.
We'll talking about that soon.
These utility bills are just getting out of control.
Out of control, and they just keep on going up. All right. Well, Anna, we appreciate you.
Thank you.
Thank you so much.
See you next time.
Okay.
We will see you next time. Amber, anything else?
No, I loved the fast facts.
That was good fast facts.
Yep.
We love our nurses around these
We
parts.
do.
And just in general. And we will, once again, we'll be on our regular schedule of next week off and then another week back. And I think the next one is our last of our bill reviews. And I think
really?
I think the next episode may be which bills didn't make it. We'll talk about some bills that didn't get across the finish line or didn't get a hearing, all sorts of things, and for various reasons. So we're going to talk about that, I think, next time.
And some that we were happy about and some that we weren't.
Some we were not happy and some we were very happy. Yep. All right.
Okay.
Well, I appreciate you, Amber. Thank you for your continued hard work.
You.
And thank you to all of you who sticking with it and listening and watching us. And so we will see you next time on the Legislative Director, talking about legislative things. See you then.